If you're considering anterior lumbar interbody fusion, it's important to fully understand what it involves, why it may be recommended, and what to expect. As a board-certified neurosurgeon, I'm going to break it down for you step by step. Today, I'm discussing anterior lumbar interbody fusion, or ALIF surgery. I'll show you exactly what it involves, who it's for, who it's not for, and what to expect. After performing hundreds, if not thousands, of spine fusion operations, I've seen incredible successes with ALIF surgeries. I've seen firsthand how this surgery can transform lives when done correctly. But the surgery is not without its risks, and it's not for everybody. Let's start by understanding exactly what an ALIF surgery is and why it's unique. Unlike traditional spine fusion that accesses your spine from the back, an ALIF approaches through the front of your body. Think about it like this. If you needed to replace the engine in your car, would you try to do it through the trunk, or would you lift the hood? An ALIF is like lifting the hood. It gives us direct access to the problem area when that problem area is the lumbar disc. And here's what makes an ALIF different. We access the spine through a small incision in your abdomen. Your back muscles remain completely untouched. We can place larger, more stable implants. The procedure can allow for better correction of the spine's alignment, and recovery is often faster than traditional approaches. Now let's talk about the goals and indications for an ALIF. The primary goal of an ALIF is to relieve pain caused by lumbar spine disc degeneration, spinal instability, nerve compression, failed back surgery, or scoliosis. Now I'm going to break that down even further. You may be a candidate for an ALIF if you have degenerative disc disease. This is when the spinal disc has worn down over time and your pain is primarily in your low back. You have no major nerve compression from the back part of your spine, and conservative measures have failed. In this setting, removing the disc from the front of your spine and fusing the two vertebrae together may substantially reduce your back pain. Another problem that may be treated with an ALIF is spondylolisthesis. This is when one vertebrae has slipped forward over another, possibly causing pinching of the nerve that sits between those two vertebrae. The slippage can cause instability and pain. An ALIF can stop the vertebrae from slipping further, and it can open up the tunnel where the nerve is located, treating both back pain and nerve-related symptoms. If you've had a previous back surgery and you have persistent or recurrent pain from that level of your spine, or if you've had a prior posterior fusion that failed, your spine may be unstable and may benefit from a fusion through the front. If you have scoliosis or an abnormal curvature of the spine, an ALIF may be used in combination with other spine procedures to help correct that abnormal curvature and help return your alignment to more normal angles. But not everybody is a good candidate for ALIF surgery, and not everybody would benefit from this approach. If you have severe osteoporosis, your bones may not be strong enough to hold the hardware, and the risk of implant failure is high. If you've had multiple previous abdominal surgeries, the scar tissue can make this approach dangerous, and the risk of organ injury increases significantly. If you have severe nerve compression from the posterior or back part of the spine, the best way to directly unpinch the nerve is from the back, or a posterior approach, not an ALIF. If you are morbidly obese, this can substantially increase your risks associated with this procedure. If you smoke or use nicotine products, these toxins prevent your bones from healing properly, putting you at risk for a failed fusion. Now, let's break down exactly how an ALIF is performed. Surgery is performed under general anesthesia and typically takes 2 to 4 hours, depending on the number of levels being fused, the patient's vascular anatomy in that area, and the general health of the patient. A small incision is made in the lower abdomen, avoiding disruption to the major back muscles. The surgeon carefully moves aside abdominal structures and blood vessels to access the spine. Oftentimes, this portion of the surgery is performed by a vascular surgeon or general surgeon who has additional expertise operating in this area of the body. The problematic disc between the two vertebrae is then removed, creating space for stabilization. If necessary, bone spurs or other structures pressing on the nerves are also cleared away. A spinal implant with bone graft is then inserted into the space where the disc was removed. A plate with screws may be added as well. Over time, the bone graft encourages the vertebrae to grow together, forming a solid, stable structure that eliminates painful movement. Now here's what to expect after an ALIF. After surgery, most patients stay 1 to 3 days in the hospital for close monitoring through their initial recovery. You will be encouraged to walk, and you will learn techniques for getting in and out of bed and participating in normal activities of daily living, while also minimizing bending, lifting, and twisting. You may be given a back brace to wear for weeks to months after surgery. Strenuous exercise should be avoided early on, but many patients resume light activities soon after surgery. You may be prescribed physical therapy to help strengthen your core and restore your mobility. Though it typically takes 3 to 12 months for the bones to fully fuse, many people start feeling better within days to weeks after surgery. So, is an ALIF surgery right for you? The answer depends entirely on your specific condition, overall health, and lifestyle factors. While an ALIF can offer significant advantages like preserved back muscles and faster recovery, it's not the right choice for everyone. In fact, most patients with low back problems actually need a posterior approach, as opposed to the ALIF. If you're struggling with chronic back pain or spinal instability, your next step should be a thorough evaluation with a qualified spine surgeon. They can determine if an ALIF or another approach is right for you. In preparation for that consultation, I've created a video outlining what to ask your spine surgeon to ensure you are fully prepared to make the right decision for you. Click the link in the description to watch that video next. And if you want to learn more about your spine surgery options, subscribe to this channel where I break down complex spine topics into clear information. Thank you for watching, and I'll see you next time.